Dr. Surani joins us live to discuss this recent rise and why there is no need to panic yet. Dr. Surani, good morning. We don't want to panic, but we're seeing the rises in cases. What should we do at this point? And we don't want to panic. Should we panic or not?
Good morning, Barbie. Glad to be here. The key thing is that, the main purpose of vaccination is to prevent acute illnesses and hospitalization. It has done the job very effectively. But the COVID is coming back with the Omicron variant and now BA4 and BA5. It's very transmissible. The challenge is that the people are getting infected again, even the people who are vaccinated. And people who had the infection in the past are getting reinfection. Almost 1.6 million cases of reinfection we have seen in US. California and New York, they had 200,000 plus cases each. Initially, I think those were the leaders. Now, if you look at it, yesterday alone, more than 100,000 cases of COVID-19 happened in US. And what we are seeing is the tip of the iceberg, because a lot of the folks are now doing home testings, and those are not reported. Texas's numbers are going up. It was close to 11,000 yesterday, and even the Nueces County numbers are going up. So what can we do? There are several things. If almost 1/3 of the population is not vaccinated, go ahead and get vaccinated. Second thing is the immunity from the vaccination phase off. So if you're eligible for booster, go ahead and get a booster. There was a big gap where the kids, 2 or 3-year-old toddler will go to the daycare and they bring the bugs from there and make it a family bug. Now we have a vaccination for the 6 months to 4 and 5 years of age. So get vaccinated. Now what the public responsibility? Simple measures. If you're indoor, you're in a gathering, try to go back to the mask, keep some physical distancing, do the hand washing, and those things can go a long way in having a significant illness, especially if you're immunocompromised or if you're not boosted. We don't want the number in the hospital to go up, and we have seen it going trickling up, but you have to make sure, be vigilant, practice safe distancing, wear the mask, get vaccinated, get boosted, and you'll be fine.
Dr. Surani, really quickly, I wanted to ask about children. Should they get a booster? And if so, should they do it now or wait until the fall when it gets closer to school?
So the main thing is that it all depends on when was your last vaccination. So if your vaccination is 4 months away, then yes, you can get the booster. But if you're talking about the little kids, the Moderna and Pfizer, both vaccination schedules are a little bit different. So your healthcare provider can guide you with that.
All right. Thank you so much for all of your help, Dr. Surani. We appreciate you as always. If you have a question for Dr. Surani, text it to the number on your screen, 361-855-6397.